Good Friday morning. We are at the end of January. Hard to believe it's already been a month, but we have a lot to get through. And we're going to start with the state legislature and then move to Congress, the administration, and impacts of the reconciliation bill Congress passed. So there's a lot of activity in the legislature that is best described as frantic. We have about 3 weeks before the assembly says it would like to be done for the session. So there have been lots of public hearings that have happened this week. That will probably continue next week and the week after, because there's an effort to get as many bills to have a public hearing so that they can be moved to the next part of the process so that they might have a chance at being scheduled for a full vote by the assembly before it adjourns. There, after the assembly ends its session, whenever that is, anything that has a Senate version of the bill that hasn't already passed the assembly dies. That's the technical term for a bill that has no way to move forward in the legislative process anymore and has to wait until the next legislative cycle to start all over again. So there's a lot of movement to try and get the assembly to do as much as possible now, because after it ends its session, then whatever the assembly has already passed that the Senate hasn't becomes kind of the list of items that can still be done. So I'm going to highlight again that there are a number of, it's not only bills the legislature can advance that it's drafted and wants to pass. The legislature also sometimes makes decisions by not doing things. And we've talked about several of these items before, but I want to take a moment because, there is a consequence in the short term and in the long term when programs that people rely on don't have enough money and the legislature doesn't provide enough for them to fully operate or fully serve all the people who are eligible to be in them. And there are several examples of this right now that impact people with disabilities. Special education, the Division of Vocational Rehab. Those are items that the legislature did not budget enough for in its current budget, and there is now a shortfall or a gap between how much the program needs to run and how much it actually has. There are also some gaps in Medicaid, which is typical. Again, lots of times the legislature is relying on estimates, and sometimes there are things you can't predict, and oftentimes they're using data from a year before to make their estimates. So there's a shortfall there, as well as the legislature has continued not to act on the additional money that food share needs. And that means that right now we're about $500 million short of what is needed to do everything that we promised to do in the current budget. And that means that if the legislature makes a decision to not act and do something about these current budget holes, it means it'll be even more expensive to make sure there's enough money to make sure there's actual costs are covered in the next budget. So if you're kind of starting in the hole, you have to get out of the hole before your ground level. And for many of these programs, that would mean you would almost have to double the ask to get to where you should be right now and then make adjustments to cover increasing costs. So I'm going to hover just briefly on one bill that had a public hearing this week that we didn't talk about. There are lots of public hearings that are being noticed with very tight timelines. The law requires at least 24 hours notice in advance, which is not a lot of time if you're a person who, has plans more than a day in advance. And this one was noticed a few days ahead of time, but it's still quite a tight time frame for people who, have kids in school and plans and jobs to be able to adjust schedules if they want to be at a hearing. Um, and it's very typical this time of year where you don't get a lot of notice. So this bill actually is the Senate version of a bill that passed the Assembly. And it would essentially let teachers decide which students they wanted to keep in class because it gives broad discretion to teachers to be able to exclude students from class if they have certain types of disruptive behaviors which are undefined. So it gives teachers a lot of leeway to decide what is disruptive. And it also would require all parents in the class to be notified after a student has been disruptive or excluded so many times. And it also would put provisions in place that you would have to have a behavior plan in place before you could come back in after so many incidents. So we sent out an action alert on this bill, and there was a public hearing this week. And there were a couple of folks from the community who came and testified on the bill. Did a great job, including some folks that I have never met before. We had a young man. Well, I guess he's maybe not young, but he's younger than me, and I'm older than I was. So everybody that's younger than me is young. But he came in and he explained to the committee, all of his degrees and he had a pharmacy background. I was like, that's interesting. And then he followed up with, and I'm also autistic. I have a PhD, I'm a pharmacist. This is what I do for a living, and I'm also autistic. And let me tell you how I was bullied in school and how I think this bill would make it easier for teachers to target and others kids to bully folks, knowing that they would get a reaction. The committee only heard from people who were opposed to the bill. And a couple of those folks were parents and advocates and just folks from the community who had been in special education who were talking about their experience. I think I'm not sure if the committee has decided whether to vote on the bill yet. Every committee has a public hearing, and then they have to decide which bills that have had a public hearing they will have another meeting about, called an executive session. And if the committee votes, a majority votes to move the bill out of an executive session, that becomes a bill that the full Senate, in this case, could take up and vote on the floor. So the committee had a public hearing and heard from a lot of people like yourselves, and now it has to make a decision about whether this is a bill that they think they want to say, yes, we think the full Senate should vote on this. And yet generally, when the committee execs a bill, it indicates that there is support for the bill to pass. So in our theory of action steps here, the action step for this bill now is to say, hey, no, you had the public hearing, you heard from people, lots of things about this bill would not make things easier for students with disabilities and could make them harder. So there's no need to schedule an executive session. And if there's no executive session scheduled, then this bill would not move forward and it would die with the session. I'm going to go through these things rather quickly. I put them in our slide deck. We have talked about them before, and I'm just going to hover on the action steps. So, bills introduced to bring the level of special education funding up to what was promised in the state budget. They've been introduced. The ask is now the same. The next point in the process is for the Assembly and the Senate Education Committees to hold a public hearing on those bills. If they don't get a public hearing, they cannot move forward in the legislative process. So that's one tangible ask for advocates this week. The DVR funding. I will say that Survival Coalition sent a letter to the entire legislature this week saying how important DVR funding is. And this is a different group of legislators that can make a decision about whether or not to provide that extra money DVR needs. So the ask for this issue is really directed to two people who are co-chairs of the Joint Finance Committee. That's the committee that does the budget writing for the legislature, but also is the one who makes decisions even when the legislature is out of session, when things come up like not enough money for a certain program, because there's always things that are unexpected. And you can ask those two people to schedule what is called a 1310 hearing to approve the DVR funding request. Food share requirements. There has still not been any action on providing additional funding to keep food share running. And you might remember HR 1 made changes that will require states and people to do more work and will also reduce the amount of funding for the program. That reduction in federal funding for the program goes into effect actually fairly soon. October 1st, 2026, we are going to have a $32.5 million less to operate the program than we do now, because that's the amount of federal funding that's reduced, as well as having to do more work with fewer people. So action steps with SNAP. This time it really is a full press. There's no, if you can contact your state senator and state assembly representative on this one. And I think the message is for those of you who are on SNAP yourself or who work with clients or populations of people who may be working and don't earn enough to afford food, I think it's really helpful for legislators to understand that the people who are getting SNAP benefits are many of them are working, many of them have fixed or low incomes, and it's a good way to tie in that the rising costs of many other things, including housing and healthcare, all put the squeeze on whether or not people have enough money for other basic needs like food. We have a couple other bills that we're watching. I won't spend a ton of time on them, but expect that some of these things could move for a full floor vote in the next couple of weeks. And so if you have concerns about them, the time to contact your state representative and state senator is now, and also the governor's office, because oftentimes the governor will get a whole set of bills and then have to figure out within a set amount of time which ones he wants to sign into law and which ones he wants to veto. So it's always a good reminder that at this point in the session, it's good to make sure the governor knows your opinion on various pieces of legislation as well. It is certainly possible we will see more bills introduced in the next week that are kind of on their last gasp to try and get through the process. When the legislature wants to act quickly, they sometimes can. And when they want to use time as an excuse to not do something, they sometimes can do that too. So it really depends on the will of the legislature as to whether or not they want to move certain bills forward or let them die. And constituents can be a big reason why they decide to either move something forward or let it go. I'm just leaving that timeline in there for you, but we don't need to cover it. So Congress, we are on January 30th. That's where we are. This is the date that Congress set when it reopened the government in December as the time frame where the continuing resolution that is keeping various federal agencies going expires. So as of midnight tonight, if the final 2026 budgets for the remaining 6 budget bills aren't passed, then either Congress has to do another continuing resolution or the federal government, the agencies that do not have a permanent budget bill will shut down. And that includes pretty important agencies to people with disabilities, namely the Department of Health and Human Services and the Department of Education, but also housing and the Department of Labor as well. So The House is actually not in Washington, D.C. this week. And that kind of means that they aren't there to approve a continuing resolution right now. So that means whatever the U.S. Senate doesn't act on, we will end up with a shutdown as of midnight tonight. Now, there's been some developments over the last 12 hours. Remember, there's 12 permanent appropriation bills. 6 have passed and been signed into law, and there are 6 left. And they're right there. All they need is the U.S. Senate to say yes. And those agencies have a permanent 2026 federal budget. Last week, Saturday, a Wisconsin native and now Minnesota resident was killed as he was observing in some protests last week. And that has kind of given some new urgency to whether or not the Department of Homeland Security budget should be changed and whether or not there should be some additional language added that would potentially restrict how that the Immigration, Customs and Enforcement and the Border Patrol is operating currently. So last Friday, the House passed all 6 remaining appropriations bills, including the budget for the Department of Homeland Security, with really no changes to it. On Saturday, that event happened. And since that time, there has been a real change in, at least from the Democrats' perspective, on whether or not they should approve the current Homeland Security budget, given the events of the last weeks. So earlier this week, the Senate Democrats told the Republicans that they were certainly willing to pass the 5 budget bills they agree on, which includes the labor, HHS, Department of Education, Transportation, and Housing budgets, and that they would want the Department of Homeland Security budget removed from that package of 6 bills, and that they wanted to pass a continuing resolution until they negotiated what the final budget would be. You might remember that the House had an independent vote on the Department of Homeland Security budget. So they passed 5 bills as a package and had a separate vote on the Department of Homeland Security budget. The Senate decided they wanted to put all 6 bills together to have one vote. And the Democrats said, no, we think that what the House did was okay. Let's have a vote on 5 bills and a separate vote on DHS. But yesterday, the Senate Republicans said, no, we're going to hold a vote on the 6-bill package, which failed, as it was expected to. And the Senate Republicans did that because the president also had indicated earlier in the week that he preferred all 6 bills to go as one unit, which means that it's either an up or down vote on everything as opposed to voting on the things you agree with to approve and then continuing to work on the outstanding issues on the Department of Homeland Security budget. So late Thursday evening, the president and the Democratic leadership announced a deal to avoid a government shutdown. And that deal looks very similar to what the Democrats asked for earlier in the week. A vote on 5 budget bills, and then passing a 2-week continuing resolution to keep the Department of Homeland Security operating, but also negotiate on additional changes. Individual senators are now demanding changes to the bills that were passed by the House in order to get their vote. And there's one particular senator that's named, but once you get one person who is willing to say, nope, I'm going to withhold my vote unless you do these things, oftentimes that encourages other members to also, behind closed doors, come up with a list of demands of things they want changed too. So it is unclear at this point if the agreement that President Trump and the Democrats have is able to move forward it needs, Senate Republicans supporting the idea of voting on these five bills independently from the Department of Homeland Security. And we have until midnight to figure it out. Now, the other important point is if there are any changes, like some individual senators are claiming to want behind the scenes to the five bills that where there is agreement, then the House has to agree to those changes. And behind the scenes, some House members are now starting to demand their own changes. Like if things come back to the House, they might want some things to be different too, including some attaching things like the SAVE Act, which has a big implication on voting, for example. Lots of times when you get into a must-pass situation, people start wanting to attach different pieces of legislation because they see it as a train that's already moving. And if you get your stuff on the train, it'll move with it, right? So it's really unclear right now. We've got a little more than 12 hours, plenty of time, whether we will end up with five more appropriation bills being passed and signed into law and one that's still outstanding, or if we will end up with six appropriation bills that have not been passed and no ability to do a continuing resolution until at least Monday, and several agencies that are unable to operate. Since the House is out this week, if the Senate passes the five bills that have agreement, the president can sign those into law. If they make changes or they fail to pass these bills, then we're in a government shutdown. Clear as mud. So the questions that we have are similar again, and we don't know if we're in a shutdown yet, but if that's a possibility, then what is Congress going to do to make sure the administration doesn't target certain states or programs by stopping or shifting funding, those types of things? It should also be noted that H.R. 1, with the reconciliation bill that passed in July, independently funded the Department of Homeland Security, Immigration, and Border Patrol agencies through the statute. So there is money for those agencies to continue operating regardless of whether or not the 2026 federal DHS appropriation bill goes through. The real question is, will there be any provisions attached to that appropriations bill that would change how those agencies are able to operate right now? So the funding, we're talking a lot about funding, but the big bill that passed in July provided 4 years of funding for those agencies within DHS, independent, and that is money that they can use regardless of what happens in the federal appropriation bill. That is not true of the other five agencies or five appropriation bills that really need Congress to act every year to approve the amount of funding that they are eligible for. For those of you who are following telehealth and community health centers, again, the continuing resolution was the way that telehealth services were allowed to be rebilled, and the appropriations bill is what will continue those things. So the shutdown, any shutdown would actually have some disruption in billing because telehealth has not been authorized outside of a continuing resolution. And it's a quirky example, but important to a lot of people. Moving on to the ACA subsidies. Will they be extended? Remember in December, Congress said, oh, we have plenty of time. We can get this done by the end of January. And there were lots of us who said, you actually don't have time, and you should have done it, really in July, and you didn't. And you should have done it in October, and you definitely should have done it before the open enrollment period started. So lots of folks who have expertise in this area were saying really December is kind of too late. You know, you've already in the middle of open enrollment, and people are having to make choices about plans. But Congress said, oh, no, no, it'll be fine. We can do it in January and retroactively, you know, apply subsidies, etc. Lots of folks were skeptical that Congress could get this done. And it looks like those skeptics are going to be the ones who end up being right. Just this Wednesday, the Senate Republicans sent their best and final offer to on the Affordable Care Act subsidies to four of the Senate Democrats that they've been working with to negotiate a subsidy extension. There's been no formal legislative text publicly released, and you can see what the proposal would do. I think it's important to note that while this is talking about extending the subsidies, it's only talking about extending them for a year and then phasing them out over the next 2 years. And there are a number of changes that make these subsidies very different from what we had last year, which means it is, even if this proposal were to become law, it would take a lot of time for states to make changes, and people would also have to understand what those changes are and also take action on whatever options they have. So, you know, this is not we're just going to continue what we did last year. This is a temporary thing that implements a whole bunch of changes that are different and would be pretty hard to do on a tight timeline. The Senate Democrats have raised concerns about several elements of this plan that you see up there. And it looks like they are not going to accept this as good enough. There's also no timeline on when legislation would be introduced or could pass. So for lots of people who have been watching this, this is kind of the last flicker of hope that is going out, that there will be any way to address the subsidies. And now we are starting to have a clearer, but not quite final picture of what the expiration of the Affordable Care Act subsidies is meaning. So there are 30 states that use the federal health exchanges to help people sign up for ACA marketplace plans. And there are 20 states that run their own state exchanges. So what we know right now is that open enrollment has ended as of January 15th, and we have data from the 30 states that use the federal exchanges. That includes Wisconsin. And now we know that there are 1 million fewer people who signed up for coverage. So 1 million people who were in the ACA last year are now not in the ACA. There are a few states that still have open enrollment open, and we don't know in the 20 states that run their own exchanges how many people who were signed up last year signed up this year. So kind of think about that 1 million fewer people in the ACA as being the baseline, and expect it to come up, that number to go up in the coming months. I believe the Congressional Budget Office, when the reconciliation bill was passed, did an estimate that they thought about 2 million people would drop out of the Affordable Care Act marketplace if the subsidies expired and if the other changes that were in H.R. 1 to the Affordable Care Act were put in place. So right now we're at 1 million, but there are also potentially a lot more people who will be dropping off, and this will continue to be a story. The next point in time that's important is April, because there are lots of people who might have been automatically enrolled in plans and maybe didn't realize how much their premiums were going to rise until they get their first bill. So whenever that first billing cycle is, Then people have time to pay that bill. And then generally, if you don't pay that bill, there's a little grace period. And eventually, if you haven't paid your bill, you lose your health care coverage. And it looks like April is kind of the first point where we will be able to see the results of people who are not paying their premiums or are somehow disenrolling because of unanticipated costs. And interestingly enough, there was some polling done that shows that the cost of healthcare is now Americans' top worry. It's just such an expensive and unpredictable expense that lots of folks are really finding it a focus in their budget. We've been talking about, will there be another reconciliation bill? This is an idea that keeps coming up. And in the last few weeks, there's kind of a subgroup of Republicans in the House. They've released a framework on what they think should be in another reconciliation bill. And now they're starting to make their case to their larger Republican caucus, the other Republicans in the House. Some members have said, well, we don't really want to do another big bill that can pass with only Republican votes because we're kind of worried about what that might mean for our chances to be reelected in November. Other people see this as a real opportunity and are trying to point out various parts of the plan that they've released that they think would actually be appealing to voters. And some of them are saying, well, now is the time to advance policies we want because we're in the majority and we might not be after the next election cycle. So there's really, no reason not to act now. Important to remember, the current Congress is seated through January 2nd of next year. So that means that they can talk about a bill and they can have it all ready behind the scenes, and they don't necessarily need to act on it until they know the results of the next election. And oftentimes you will see or hear something referred to as a lame duck session. There is time after the November election date and before the next Congress, and this happens at state levels too, so Congress or legislature is seated, to pass more bills. And sometimes they choose to do that. Sometimes there's a need to, like if you have a budget that's really out of whack at the state level, you might have a budget repair bill, and it will be the current legislature that passes that before the next legislature is seated and takes over decision making. So this is just something to be aware of, that there's actually quite a bit of time for the current Congress to still do stuff. And they might be thinking about what are our plans next November and December, and there could be a reason to either do a reconciliation bill, especially if you know that you've retained your majority in the Senate or in the House. Because if you know that regardless of, when the next Congress is seated, if you know that you hold the majority in one House, that makes it really hard to undo anything that Congress would pass this session. All right. Moving on to actions by the federal administration. The Center for Budget and Policy Priorities, it's a little bit left-leaning, but they do some good analysis. And they put out some analysis this week that is saying, hey, there's a real pattern here with the administration withholding federal money and doing so in a way that looks like they're trying to put pressure on states to do stuff that they want, or actively punish states where they perceive that there are folks that don't agree or leadership that doesn't agree with some of the policies of the administration. And they kind of go through some of the examples that we've already seen. And then also talk about that this is a pattern where it's going to be very hard for states to know whether any federal funding should be considered under threat of being either frozen, terminated, or withheld if the administration sees the withholding, freezing, or termination of those funds as being a way to get their way with a state. We've covered a lot of the different court cases that are ongoing where various states and local governments and different entities are suing because the administration has stopped certain kinds of funding or withdrawn grants or other things. And a lot of times, there have been many wins on those court cases, but the pattern of behavior is similar, and it takes a lot of time to win those cases and get those funds. So if you are an entity that is relying on federal funding and it's stopped, even if you win the court case, it's taking you a lot of time and a lot of money to be able to win the court case. And in the meantime, you have not had that federal funding. So there have been a number of changes, partly from the reconciliation bill on federal rules. And these are two articles that are coming out about topics we've covered before. We haven't covered as much the repeal of the minimum staffing standards for nursing homes, but that is something that has now happened. The HR 1 delayed the implementation of those rules, which advocates spent many years advocating for and were finally put into place. And then the federal agency that was in charge of that federal rule formally repealed it altogether after the bill had passed. The second rescinded regulation is about home care workers. And it's been in effect for about 10 years, but by removing the regulation, we're going back to 1975. And the home care workers are no longer required to be paid minimum wage or overtime or payment for travel between clients because this change has happened. Both of these changes have been advocated for by both of the repeals have been advocated for by representatives of various trade associations. Certainly, there are lots of advocates and workers who had very different opinions, and that's why those rules were in place in the first place. We've also covered a continuing experiment within Medicare for prior authorizations. This is happening in 6 states using AI. And this is the first article that I've seen that says, hey, maybe this could happen in other states without congressional approval, just by CMS, making a decision. Those are always important things to think about as an advocate, is who is the decider. And if the decider is supposed to be Congress, then there's a certain set of okay, who do you advocate for? But if the decider is the federal agency and they have the ability to change something, then it's a very different set of people to try and influence. And there's less accountability in a federal agency to voters, certainly, than there is to Congress. A little bit more about the nursing home rule that has been rescinded. There's a big New York Times article that was kind of tracing the money, why this particular rule. And it does seem like there has been at least some indication that the industry has been working pretty hard behind the scenes to make sure that this rule never has to be implemented. For a lot of advocates who have been very concerned about the number of workers and the conditions within regulated facilities like nursing homes, this is a big loss. And they fought for this rule because there's some pretty clear evidence that when you have fewer staff, you get less care and not good, not better care. And some analysis has said like that is a reason why people are in worse condition or are dying more quickly is because they do not have the staffing ratio. So you can see that, there's the folks that had a real reason for advocating the rule are now being like all of the work that they did for many years is now being undone. And it doesn't change the issue, which is we have too few workers, both in the home and community-based side and nursing homes, to be able to provide an adequate level of care for lots of people who really need it in the older adult and disability community. This week as well, there's been a couple of developments with vaccines. There is a new chair on the advisory committee on immunization practices and who has fairly strong views on whether people should be required to have vaccines. And I'll let you read what the new chair is saying, but it is, at least within my lifetime, and I come from, my mother remembers having, where polio was kind of a constant concern. Polio has been one disease where there has been pretty strong agreement historically about a vaccine preventing that disease as being a good thing. That has been historically true of measles as well. So, it is a shift not only in what is being said, but, ideology when somebody who is in the position to be, making recommendations on vaccinations is saying all of those shots should be optional, including for diseases that have been pretty widely eliminated in the country and had really big impacts on public health. Another development this week, a different advisory council, DHS has now appointed, this may be a mistake. I saw a correction earlier. It might be all 21. Originally, the story said 19 of 21 members to a federal committee that advises on autism. And these members seem to share a thoughts in common that they are skeptical or do not believe that there is no connection to vaccines and autism. Many of the scientists that used to serve on this committee are now gone, and many of the longtime autism advocacy groups, some of the autism advocacy groups have had a pretty big footprint in research on autism, are no longer at the table either. And several of the committee members do have some connections to other groups that are known for promoting treatments or saying that autism is caused by different things that really are not accepted by most of the mainstream researchers and experts on autism. Following from that, in a recent article also is talking about, this is continuing to be fallout from earlier comments made in September by the administration, where a certain drug, Leucorovin, I may not be saying that right, somebody will correct me, was promoted as being a way to treat autism. And it's now coming to pass that there are some doctors who are writing prescriptions for this drug for autistic children. It is against the advice of the medical groups, and probably at the request of parents who would like there to be a way to change their autistic child. And so now some pediatricians who are saying, like, look, we've been through this cycle before where there's some easy thing that's identified that people who want, to have hope that they can do just one thing and things will be different for them, will glom onto. And this is a pattern where we've seen, you know, various things recommended as being treatments or cures for autism, and none of them have panned out as being a solution. And we're in another phase. But this time we're in a phase where some of these new ideas, the next great magic thing, are being done in a context where there are fewer folks in positions of decision making that are going to question whether those treatments should be tried and whether those treatments may have actual harm to people who are getting them. There are a couple of quotes. AI is kind of artificial intelligence is kind of a buzzword now, and there's a couple of articles that are showing how the government may be thinking about using it, which are kind of interesting. We've talked before about how many federal agencies, especially after DOGE, have been combining different kinds of data that were separate before, and perhaps trying to figure out or mine that data to look for patterns or certain relationships. We've also talked about how that data isn't perfect and it was never intended to be married together. And so the likelihood that there are mistakes is pretty high. Well, these couple of articles are saying, hey, when AI is being used, it is not necessarily accurate. And now we have one of the federal agencies who is interested in using AI to write regulations and saying we don't need the perfect rule, we want good enough. So this is something to continue to watch, because one of the things that advocates have been worried about is what kind of pattern recognition or artificial intelligence is going to start being used when people are renewing programs or eligibility or diagnostic processes or are getting prior authorizations. Like, sometimes a big pattern is good enough, and sometimes the wrong result can have huge impacts for individuals. So it's something that is kind of flying under the radar, but I think is important now that we have lots of data that has gone somewhere and is being used or being requested from states, and it's not clear how that data is being analyzed or used. There've been there's been coverage of the operations of Immigration and Custom Enforcement and impact on people with disabilities. We've talked before about how many people who are care workers are immigrants. About 30% of the care workers workforce are immigrants. Many of them were here legally on temporary protected statuses that may have been revoked by this current administration. So they had a legal status that has changed. And so lots of people have now mixed status families where their children may be U.S. citizens because they were born here, but one or more relatives may have a different status. And that is really impactful when it comes to, enforcement with people being taken away, that there are ripple effects that then impact American citizens who are here legally too. And there's been a couple of articles about, what has happened when someone has been detained or sent to a camp or deported, and the people that they are here legally that they leave behind sometimes cannot continue to manage without those other folks from their families. There was an article, we've talked about the public charge rule before, This article goes into the history of public charge. This week, the administration essentially paused visa applications for a number of countries on the grounds that people from those countries are of nationalities at high risk of public benefits usage. So, in other words, this new rule is being used as a way to keep some people out who they think, by virtue of where they're coming from, or their poverty status, or their disability status, or their health status, they might, if they came into the country, they might be able to use some of our programs that are publicly funded, like SNAP or Medicaid. So it's an interesting article that kind of shows how these types of policies have been used in the past, and that they really are stemming from the idea that there are some people who are um, who are desirable to keep out. And a lot of times that traces back to disability or health being a reason to not let people in. This week, also, many of you have posted this one already. And I think it is worth noting that the public policy on who we think should be let in and who should be kept out is occurring at the same time that we see different rhetoric being used pretty consistently by decision makers now that are pretty derogatory to people with disabilities. So I don't want to spend too much time on there except to connect that we are starting to hear, very consistently the same kinds of language or the same kinds of assumptions, and it is being turned into policy. At the same time, we are starting to hear derogatory terms used more broadly by more people. There's also an additional court case that came out this week. This summer, there were 15 states that were suing, and this was going to the Supreme Court, that the Section 504 law was being inappropriately used to extend greater accommodations to people than should be under a federal rule. And advocates for people with disabilities pointed out that the lawsuit, which was really intended to remove additional rights for transgendered people from the rule, had a bigger and broader effect and would apply to all people with disabilities. And in the summer, there were 8 states that withdrew from the case because it wasn't their intention to undermine the entire section of the Rehabilitation Act. They were really trying to say that, they were trying to have a narrower focus. However, there are 9 states that are now renewing that attack, and are trying to challenge the idea that people with disabilities have the right to receive services in the community rather than in the institutions. The case is still about a federal rule, but it has larger implications that if the case goes the right way, it could really undermine the idea that it's a violation of the law if a disabled person is at greater risk of unnecessary institutionalization. And that would essentially make it a lot harder for disabled people to claim that an actor who has not done what they should do and where it has resulted in somebody who could live in the community who is now forced to live in an institution, it would be harder for that person with a disability to say that that entity did something wrong that was illegal if this case goes the right way. Moving on to the implementation of HR 1, there are a couple of kind of big nerd um, publications that have come out from KFF this week. And it, we've been talking about how state budgets are going to be impacted by these big shifts in federal funding for more than a year. So this isn't new news to the folks who have heard that message for the last year, but now it's starting to be published by real experts, and we're starting to get a much clearer picture of just how much of a strain these cuts from HR 1 are going to be for state budgets. We know what states have the ability to do under federal law. They can restrict reimbursement rates for a variety of providers. They can lower payment rates. And, those things have real impacts on workforce shortages, especially for people who need home and community-based and long-term care. We're starting to see that what is shaping up is many, many states who have Medicaid as one of the biggest parts of their state budget are also seeing declining money coming in and lots of other costs that they have going up, which all makes it much more likely that states are going to have to do really tough budget cutting decisions in the short term and probably over the next several legislative cycles. So the reason this is really important to people with disabilities and older adults is Medicaid is probably going to be a big target because it's such a big spending item. It's the biggest spending item and the largest source of federal revenue for states, and it pays for about 70% of all home care spending in this country. Medicaid, home and community-based services are all optional under federal law. Everything you know about Family Care Iris and CLTS, all optional services. So that gives states kind of the green light to say, look here first. Look at these things that are the most expensive things to do. And because the people who are in long-term care tend to need the most help over the longest time, and that means higher costs, it's almost a green light to say, look here for where to cut first. Unfortunately, there's nowhere else for any of these folks to go because long-term care is really not paid for unless you have the ability to private pay for it. And yes, Medicare will cover a set amount of time in a rehabilitation facility. But for the most part, unless you're private paying, you're probably relying on Medicaid for long-term care. And about 30% of states are already saying they are planning to try and drive down home health care costs. So when they have a big budget problem, going after the biggest spending area is a way to get to your savings quickly. And there's a historical pattern of this, where all states reduce spending on home care by either serving fewer people or by cutting benefits or payment rates for long-term care providers. So now we're at the cusp where this is starting to happen, and the climate and the landscape that, people who watch state budgets look at is looking very, very much like everything you were warning about in 2025 is going to start happening. And in some states, it's happening already, and in other states, it will happen in the next budget cycle. We're going to focus a little bit on Idaho because there are at least 4 states where already we're starting to see proposals and proposed cuts to home and community-based care. Interestingly, because Medicaid is a matching program, which means the states put in a set amount of money and then the federal government gives them more to come up to 100%. For our state, when we put in about 40% of the cost, then we get 60% more federal dollars. So you put in some and you get more is how Medicaid, And frankly, other federal programs often work for states. So when these states are proposing to cut the amount of state money that they're putting into Medicaid, they are also automatically reducing the amount of federal dollars that are coming into the state. And it's probably more federal dollars than what they're cutting out of the state funding, because Medicaid isn't going to give you a matching rate when you're not providing the full match. So we've talked about Idaho's proposal to cut $45 million in Medicaid. Well, that also means that they're getting $106 million less in federal funds. So the total amount in their budget that is impacted is actually 100 and, math, 50. I'm not a math person. It's a lot more than 45 million. Lawmakers are starting to say, hey, wait a minute. What happens if we cut these dollars in Medicaid? Is that going to mean we'll have more costs somewhere else? And nobody seems to be willing to think about or answer that question. There are definitely, at least in Idaho, some suggestions that they are not able to assess if we cut Medicaid dollars, where do the things that Medicaid's paying for end up being covered, if they are covered at all? And a different article is talking specifically about home and community-based services, because at least part of the $44 million in state funding cuts are including HCBS services. And the state agency is saying, well, if we cut home and community-based services, it serves about 16,000 people in Idaho. And if those services go away, they are flat out saying, we think we'll need institutional providers because, we will have to build up our institutions if we cut HCBS services, because those people won't be able to be supported at home. And you might remember that institutional services are federally mandated under federal law. So yes, you are in the short term cutting home and community-based services, which support a lot of people for a much, much lower cost than supporting fewer people and a much, much higher cost in institutions. And these are the kinds of short-term trade-offs that states are going to start thinking about. Are we willing to make that trade-off? In the same vein, and I'm including this article because I think it is relevant in the terms of, we are also seeing cuts to potentially the U.S. Department of Education, which does manage federal dollars that come to states for IDEA. We are seeing cuts that have happened already to U.S. Department of Education civil rights enforcement when states aren't doing what they're supposed to under IDEA. And money states are in the same situation Wisconsin is in, which is the amount of money that they get from the federal government for IDEA implementation has never been enough. And the states have not put in enough money to really reimburse school districts anywhere close to the actual cost of providing those services. So this article is important because, again, it's another piece in the pattern of how some lawmakers start thinking about populations of people when it comes to tight budgets and where we should spend or not spend the money. This particular lawmaker, and he is not alone in this, and I do not think that we should assume any lawmaker is not thinking this, is actively questioning, why are we investing money in special education if these kids have no future because they have disabilities? That's really old ways of thinking, but in a tight budget time, when you have lawmakers who might be unwilling to spend on Medicaid or are making cuts there, and you have another big ticket item where they're looking to make cuts, the people who are impacted by multiple public programs are ending up going to feel cuts maybe from multiple directions and all sides. And that certainly is true of people with intellectual and developmental disabilities, people in disabilities at large, and also low-income older adults. In a tight budget time, it becomes really easy to see rhetoric where there is questioning of whether or not we should be doing this at all for this group of folks based on what we think they can and can't do. Colorado, again, another state that already made cuts very soon after HR to Medicaid, very soon after HR 1 passed because of how they calculate their taxes, is in its second round of cuts. And part of the cuts that they are considering, this is the governor's making a proposal on cutting Medicaid and what to cut, is a small line, $1.45 million, which is currently being used to pay parent caretakers of adults with pretty significant disabilities. And this has been an ongoing topic of conversation across the country, especially in the context of a caregiver shortage, of a shortage of paid caregivers, high turnover of paid caregivers, and people who have some pretty complex needs. There has been, a lot of movement and effort to say, hey, if you have parent caregivers who are able and willing to do the job and also are, leaving their place of employment to do these tasks, maybe they should be paid just as a paid caregiver would be, because there isn't a paid caregiver to hire. So Colorado has had a way to pay certain parent caregivers who are taking care of some folks that have pretty significant needs. And they had a plan to cut the amount that they were paying those parents by 10%. That went to a hearing, and after listening to those parents, nobody wanted to make a motion at the hearing to approve the plan. But the Medicaid agency decided that it was going to do it anyway and looked towards an executive order issued by the governor as the reason it had the authority to do so. So it just kind of goes to show you can have small wins and still not win. And of course, those parents are now still in the same place where they are really uncertain about what the future is. Now, this is an article that is really from a provider trade association perspective, but I think there are a couple of important points in it. Again, it isn't only HR 1 that is putting pressure on state budgets. It is overall economic conditions. It is states that have decided to make tax cuts, which is reducing the amount of revenue coming in. It's also, there are pieces of federal money, and this article is specific to the pandemic relief funding that was passed in 2021. That funding is now coming to an end. A lot of times, federal funding that is approved, you have 3 to 4 years to spend that allotment of funding. And we are now at the point where the funding that was approved as of that time is now running out with no replacement funding. Lots of states used a good portion of that pandemic relief funding to boost the pay rates of direct service providers. And now that money is not running out, it's not only not being replaced, it's running out in a time where everything else in the landscape has changed and budgets are running short. So this is another example of how you can end up with a double hit at the same time. Not only is the pandemic money running out, but now you have the implementation of almost $1 trillion of Medicaid cuts. And that is how those direct service providers are paid, is through Medicaid. If home and community-based services are cut, either through pay rates or fewer people are allowed in, or there are fewer services approved, whatever that looks like in each state, because each state is making their own decisions, it may impact this workforce that is absolutely critical for not only for people to stay in their homes, it's the same workforce who's working in the nursing homes too. Wisconsin does not have a waiting list yet for home and community-based services, but many states do. And we've kind of covered that before, that there are more than 500,000 people who are just waiting to see if they can get access to a program that will help them stay in their homes. This is a particularly important problem for them because in some places, if you're on the waiting list and your number comes up, you have to be able to find workers within a certain period of time to stay in the waiver. And if you can't find anybody to hire to do those services, you can end up back on the waiting list. So this is a impact that's going to really hit some states particularly hard. We've also talked about SNAP. We've had a legislature that has not acted to provide additional money to meet the new federal requirements for SNAP and also make up for the lost federal funding that we are expecting will be reduced in October. This is a larger article that kind of looks at across the country what do these changes mean for states who are considering whether or not to keep doing SNAP at all. And there are certainly some states where the amount of money that they have to invest may mean that they make a decision to not keep doing the program at all. And even the states that are making decisions they don't want to necessarily not do SNAP at all, the decisions they're making now about how much to invest in technology and staffing could really impact, what their penalties are, what if they have bigger or smaller bills down the line. And some of the questions about are we going to do things like SNAP anymore? Maybe they aren't answered this time. Maybe there are some investments that are made now, but if you make investments that aren't enough, or you end up with an error rate where your state is being expected to pay a lot more money because you have too many mistakes, another legislature down the line may make a different decision about continuing to participate. Okay, I am going to stop now.
I was so